Hello, everyone. My name is Pharmacist Michael, and today I am going to talk to Julie, and she's going to talk about some health conditions and challenges she's been going through. And hopefully, this can help some people out there who might be facing similar situations. Hi, Julie. Thanks for coming
Hi,
on.
thank you for having me.
Okay, so my first question for you is tell us about what you've been going through and when it started.
So, this all started probably back around 2008 with the first time that my esophagus actually narrowed enough to where I couldn't eat. And it happened to me 3 times in 1 year. I had to go in and have EGDs done, which are where they go down your throat with a camera and they will dilate your esophagus. And at the same time, they take biopsies to make sure that you don't have cancer. So that happened 3 times in 1 year. And then I went for, 15 years or 20 years until the end of 2021. And I may be off on the time frame, but the end of 2021, around October, my esophagus closed again. And I wound up going to the emergency room because I couldn't get a GI doctor to see me soon enough. And they again did another EGD and I had severe esophagitis, and I still, after 6 to 8 weeks, I still could not eat. So I went back to the doctor I was seeing, and I told him I still couldn't eat, and I was on a new medicine called Protonics. And so he yet again, after that, did another EGD. I still couldn't eat. So he did a third EGD, and I wound up with a very short amount of time, maybe 6 weeks or so, where I could eat very slowly. I could eat very small bites. And after that, it disappeared yet again, and I couldn't eat yet again. I went for a little while longer. He did a fourth one, and after that, he put me on famotidine and he said, "I'm sorry, there's nothing else I can do for you." Yeah. I was left scrambling, unable to eat food until my PCP hooked me up with Vanderbilt. And they wound up seeing me. A world renowned doctor there in the GI department saw me with it. Well, he didn't really see me in office. He just said, let's set you up, let's get another EGD done. And he did. And there was no closure of my esophagus this time. So that left to question what was going on. They did a esophageal manometry test, and I wouldn't wish it on my worst enemy. They go up your nose with a tube that has metal, I guess you call them rivets, or I'm not sure what you would call them, but there's metal rings that go down this tube. And it goes up your nose and down your throat and all the way into your stomach. And the metal that surrounds the end of the tube measures the contractions of your esophagus. So they stick it in and then they have you sip water while it's in there while you're laying down. And then they will stand you up and they have you do it again. They found that my esophagus, even with liquids, does not move and contract well enough to get food into my stomach. So, that being said, I have been unable to eat food since pretty much the end of 2021. I've been on liquids, unable to find even Vanderbilt to say, okay, let's get you a G tube or other form of, getting nutrition to you. So I've just been unable to eat. And actually, tomorrow, finally, after waiting all this time, I am actually getting a peg tube put in, which will be my way of eating for the rest of my life, all caused from GERD or acid reflux disease.
The acid in your stomach caused your esophagus to just stop working?
It caused nerve damage and it causes a lot of scar tissue, which causes it to stop working when it's uncontrolled.
Why did it take them so long to put some sort of tube in so you could eat?
I think a lot of it was, at least with Vanderbilt, it was we want to know what's going on before we do anything. And I have advocated for myself to no end and frustration and tears. Why can't you do something? Put a PIC line in, put a port in, anything. Just give me nutrition because I'm losing weight. I can't keep doing this. I have to have something. Oh no, we're going to wait until we know what's going on. And between every single thing they did, there was 2 months to wait. So I don't know why they wouldn't do anything. Their only explanation is we want to know what's happening before we do anything.
So what's your energy level like with no food?
It really isn't very good at all. And I have lost quite a bit of weight. I've gone below the weight that my doctor, my PCP, wanted me to. She doesn't know it, but I just since my doctor's appointment April 7th, I have lost 10 pounds doing nothing different. I live on,
Okay, let's
going to sound terrible, and a lot of people are going to say, oh God, that's gross, but salad dressing, I can drink salad dressing. I had been able to drink tomato soup, but now that doesn't go down. And when I drink it and it doesn't go down, it leaves this lump at the top of your throat because it's not draining into your stomach. So it just backs up in your esophagus. And I just have to sit and wait for it to drain before I can drink anymore. So it's salad dressing, tomato soup, and chocolate milkshakes, and that's what I'm living on.
Okay, so let's go back to this GERD. Did you know you had it? Did they treat it?
Yes, I had been on Nexium for a very long time, and Nexium just wasn't doing the trick in keeping the acid in my stomach. So I knew
Did they try adding Malox and Pepsid and everything else to that to try to get the acid down?
they did not. It wasn't until I went to the ER that they put me on proton. And then after I kept telling the last doctor that I still couldn't eat and I still couldn't eat, he threw famotidine in there. And then after I took that for about 6 weeks and I went back and said, I still can't eat. What can we do? He said, I'm sorry, there's nothing else I can do for you. And that was the end of him until I finally got into Vanderbilt.
And how long's this been going on?
Since the end of 2021,
Almost 2 years.
almost 2 years, I've been unable to eat solid food except for a couple of very short stints, just weeks where I could get small things down.
But now they're gonna put a tube in so you can at least get nutrition.
Yes. Yeah, I will be on formula for the rest of my life, and that's how I'll also take my medicine. I haven't been able to take a majority of my medicines because they weren't in liquid form.
Wow.
And I'm a diabetic, so I haven't been able to take my diabetes medicine
Oh,
either. I became a type 2 diabetic during all of this. I was pre diabetic, but in all of this, not being able to eat, not being able to take care of myself, drinking milkshakes, which is probably the worst thing I could be doing with all the sugar, I changed to a type 2 diabetic, unable to take my medicine, which isn't good, but the doctors didn't
well,
seem to care.
well, you say I mean, if it's all you can eat, it's all you can eat. And you need some sort of nutrition or you'll just cease to exist at some point, right? I mean, you have to have some sort of nutrition
Yeah,
to sustain your life.
yep. And when I saw the doctor
So you
last time, he seemed upset that my weight had, not gone, that I wasn't emaciated. He almost seemed upset about that. Well, you've managed to maintain a decent weight.
Oh God.
What did you expect me to do? Not eat and become emaciated and be in and out of the hospital? I'm going to do everything I can to prevent that, no matter what I have to do.
I usually ask people, how's this change your life? And that's pretty obvious. I mean, you can't eat. Your energy level is very low.
Yes. And
Um,
I can tell you one way that it changes your life that most won't even think about is that food is such a centerpiece when you get together with people. It's always let's
right,
have lunch, let's have dinner. There's always food served somewhere in a gathering of friends. People don't want to be around you anymore. They don't want to eat in front of you because they feel bad that they're eating in front of you. And so people just don't
oh,
come out. And I have never said anything. I've bought people dinner. I don't care. Just because I can't eat doesn't mean you don't eat. I'll buy you dinner. I'll buy you
right.
lunch. Just eat. But people don't want to eat in front of you, so it's isolating at the same time, and people don't realize that.
Yeah, that is something I wouldn't have thought about. Do you have any support at all?
I do. I have I have two friends of mine that have been very supportive.
That's good.
And yeah, and I have a stepsister who has been a huge help to me. She's an RN, and she's been able to be in the doctor's visits with me via video chat to help me advocate.
Okay, this is probably going to be the most important question I'm going to ask you, at least for the audience. What advice would you give somebody who has GERD that is being treated and it's not working?
Keep advocating for yourself. One of the main reasons I wanted to do this is because people don't associate GERD or heartburn with something like this happening. And I think it's important for people to understand that if you have heartburn and it's consistent and you can't control it, or a medicine that the doctor gives you doesn't control it, do something about it. Keep going to doctors until you find somebody who will listen to you and who will do something about it. More medicines. Take a look and see. I mean, it can be something as simple as I call it a flapper, and I know it's a LES is what it is. It's the flapper at the top of your stomach that keeps acid in your stomach, and it's not supposed to let it get into your esophagus. It can get weak, but they can fix that. So my advice to
Right.
people is don't give up on it. Keep pushing to get it taken care of. Advocate for
So
your.
in your case, there's so much scar tissue that it's just never going to work again, and
No,
there's nothing they can do to fix it.
there is nothing they can do to fix it. Even if they try to get rid of scar tissue, it creates more scar tissue. And the nerve damage is not something they can fix. Earlier, they may have been able to use Botox to stimulate my esophagus to work, but it's too far gone.
Did they try that?
They have not. I think it's too far gone to try it, because I think doctor that I'm seeing now, I think he would have tried anything other than a feeding tube.
This is very interesting to me because I've never even heard of this happening. I'd like to bring you back after you've been tube feeding for a while just to see the changes that you experience from that. Because it's hard for me to even imagine living off of salad dressing, milkshakes, and tomato soup for that long. I guess you just do whatever you need to do to survive.
Yeah, and
But
it's narrowed over time. There was a time as early as 6 months ago where I could do applesauce and I could do mashed potatoes. I went so far as to order food from a medical company. It's pureed food. And for a very short amount of time, I could do those. But one by one, mashed potatoes got stuck and I couldn't do them anymore. And applesauce got stuck and I couldn't do it anymore. So one by one, the things that I could eat were gone and I could no longer do them anymore. And getting it stuck, the minute I swallow, it's over. It's done for. I know right away that I'm history. And it is the worst feeling in the world to have that happen. And aside from just having it sit there in your throat, it can do what I call being a floater, which is even worse because you can get it to partially go down and you think it's gone and then it floats right back up and into your throat, and then you can try to get rid of it again and it'll float down your esophagus and you think it's gone, and then you can feel it as it comes back up into your throat again, because no matter where your blockage is, and mine's halfway down my breastbone, it feels like it's up here in your throat. It doesn't matter where it's narrowed or where the damage is. It feels like it's in your throat.
what about choking?
I do. Even on liquids, I choke. I have a hard time keeping liquids from going down the wrong way, and it's been a nightmare. I am anxious, but I am excited to get this feeding tube. And to a lot of people, that sounds weird. That I would be so
Oh, I
excited,
don't think it sounds weird at all.
but I
I,
am.
I don't I don't think that sounds weird.
I have done all of my homework on it. I know it's going to be a learning curve, but I have done all my homework. I know or I think I know. I'm sure that I don't know as much as I think I do. But from watching people on TikTok who have the PIC
Yep.
lines, have the G tubes, and all that, I watch them, I ask questions, I watch videos, I read. So I have a pretty darn good idea of what I'm in for, and I absolutely cannot wait to get this done.
Yeah, I have a good friend on TikTok that tube feeds
Yeah.
that I could you may have already talked to her, but I mean I can she'd be happy to help you, I'm sure.
Yeah,
She's got gastroparesis.
and that's one thing
So yeah,
they told me they'd have to watch for is my stomach to stop working because of diabetes. Diabetes can cause this as well.
wow.
So,
Since I started doing these interviews, I've learned a lot, which, the reason I wanted to do this is because I don't think people realize some of the things that can happen to you, you know?
no, they definitely don't. And it's important to me to get this out there. That's why I jumped on this as quickly as I did. Because, like you said, people do not even think of heartburn causing so much trouble.
Yeah. And I mean, this is life changing for
Yeah.
you.
And the more people I can educate and the more people that can hear it, I want them to hear it because they need to do something. They need to advocate for themselves and don't stop until they get what they need and whatever it is that works to control it.
So if somebody wants to reach out and talk to you, how would they get a hold of you?
They can get me through TikTok. Feel free to connect people to me. I'm always willing to help. Always willing to help. I'm
Okay.
willing to put I think my email is on my TikTok, but if it's not, I'll put it out there. People can email me. I think my phone number's even out there.
Okay. And I have your email. So if they leave me a message, I can send it to them.
Yeah, absolutely. I'm
Um,
always willing.
so I always ask this question because I think it's important. And if the answer is no, that's fine. Is there any silver lining to this happening to you?
I think the biggest silver lining to this, if this is even a silver lining, is learning how to advocate for myself. I never realized how important it was to advocate for yourself. And surprisingly enough, how hard you really have to push to get what you need.
Right.
But I think for me, the advocating and how important it is.
And I would say this isn't a silver lining, but one common theme that keeps coming up is if one doctor doesn't help you, find another one, get a second opinion, a third opinion, a fourth opinion. If you have to go to a different city, go to a different city because sometimes you just need to find the somebody that's seen it before that knows how to treat it.
Exactly. Exactly.
And you wonder if you would have went to Vanderbilt earlier, would things have been different?
Yeah. If I had gone to Vanderbilt as my hospital instead of going to the hospital I went to, I think I would have gotten the help I needed a lot sooner. A lot sooner. But I went,
And I think there's a lot of people out there that just think, okay, if I go see a doctor, if I go to the hospital, they're going to fix me and they're all the same, but they're not.
no. There are doctors that
I
only go so far and they truly do not have your best interest at heart. They don't care.
and
And
that's really sad.
I found one.
Yeah, that's really sad.
And I'll tell you what I did
Okay,
is I emailed him. Now that I have answers, I emailed him and I told him that you need to listen to your patients. This is what it wound up being for
good.
me, and you need to start listening. What you did is unacceptable and it has caused a lot of grief for me. The point of it is you need to listen. Don't just drop patients because you don't know what's going on.
That's awesome. And I think that's great. I don't know if it'll help, but at least you're letting them know that what you did for me didn't help me at all. And if you're a doctor and you can't fix it, send the patient to someone who can. Don't just keep trying to treat something that you don't know how to treat.
Exactly. And if you don't want to treat it, then still send them to someone else instead of just saying, I'm sorry, there's nothing else I can do for you. And I think it was purely laziness. He just didn't want to have to do the work.
And as a pharmacist, there are times when I'm practicing that I don't know how to do something, especially if it has to do with a baby. And in
Mm-hmm.
that case, I call somebody and ask them. I say, what should I do? I've never experienced this before. I don't just tell them I don't know. Sorry. I mean, these are people's lives you're dealing with.
Exactly. Yep. I just can't even fathom that a doctor would do what he did. But, I know they're out there. I just can't believe I experienced it.
Wow. So, is there anything else that you'd like to tell the audience?
Nothing new, just I can't stress enough that if you're going through this, do something about it because you don't want to wind up in the place I'm in. Because I promise, I mean, even though I'm excited, I promise it's going to be a huge learning curve, and I'm sure there's going to be lots of times when it's not fun. So do everything you can for yourself to not land in this place.
So, one more question for you. Were there times along the way where you were basically convinced that you had cancer?
No, but I'll be honest, every time they did a biopsy, I was worried about it because I know that there's another condition. The name escapes me. Barrett's esophagus. Barrett's, yeah,
Yes.
where that can become cancerous. And I did worry that, one of these times that would show up. Thank God everything so far has been clear.
Well, and this should fix it, right? I mean, if you're not, well, maybe.
It,
I mean, is tube feeding going to fix the problem?
no. I right now I can only take the famotidine. Protonix doesn't come in a liquid. It is an extended release tablet. You cannot crush extended, even though I used to chew it up because no one would listen. I can't swallow pills. So if you,
Prevacid does, though.
huh?
Prevacid is a proton pump inhibitor that does come in liquid form. You have to mix it up.
Mm-hmm.
But I would immediately ask for that because it's going to work about the same.
Oh, okay. Yeah, they gave me.
So that's what we use in people at the hospital that have G tubes.
Yeah. And I may need to ask for that, and they may do that for me in the hospital. But I did get the granules of Protonix, but they don't dissolve. From what I understand, they don't dissolve. You have to use them in applesauce or apple juice, and they don't dissolve. So I can't use them in the G tube, and I can't take them by mouth.
So Prilosec can be compounded with sodium bicarb too.
Okay.
That's another thing you can do.
Does that have to go through
We do that in the
a
hospital.
pharmacy?
You might have to go to a compounding pharmacy to get it, but it's better than nothing. And you need something to stop that acid in your stomach.
Yeah. Famotidine does an okay job, but I still have heartburn every single day.
Ah, and you're not even eating
No. And it's always been I can think about food and get heartburn.
because your stomach is releasing too much acid.
Yeah. So I'm really hoping that they will put me on something else in the hospital when I go in. I mean, and I don't know with the damage being done to, I've been thinking, does it really matter? The damage is done. I'm going to be on the feeding tube. They probably are not going to want me to take much of anything by mouth because I'll also get hydration that way. So does it really matter? But
Well, it matters because of the pain that you're going to feel.
yeah,
So, you want to be as comfortable as you can.
yeah. And the famotidine,
So,
okay, it's certainly not perfect, but I'm hoping they will put me on something else because I don't want to.
or add to it, or add to it, right?
Exactly. Yep. And I don't know if the Prevacid and would Prevacid in the liquid form have to come from the pharmacy too, or is that an over the counter?
I think you would have to get a prescription. I'm not sure. Let me look into that. I mean, you might be able to make your own too, but I'm sure they can compound the Prilosec
Okay.
because we do it in the hospital all the time.
Yeah. And I can crush it into a fine powder if needed, as long as it's not extended release, and dissolve it in water and still have it go in the G tube.
Right.
So if worse comes to worse, I can do that, because that's another thing is insurance likes to fight you on getting things in liquid form.
Well, you can get a prior authorization for this because you don't have a choice.
No, they turned me
You know,
cholesterol.
you're gonna have to fight with the insurance
Yeah,
companies
yeah,
because that's ridiculous.
it is. They turned me down for my cholesterol and my blood pressure medicine.
Because it was liquid?
Mm-hmm. Yep, it's not formulary, so they won't fill it. So I was told to wait until I went in the hospital, and if it comes from the hospital, they would do it.
Oh, these insurance companies are just.
They're maddening.
So they're not going to pay for a liquid because it's not on their formulary, but that's the only thing that you can take because you can't swallow.
Exactly.
That's ludicrous.
It is. Now again, if it's not an extended release, and I don't know about the cholesterol and the blood pressure medicine, but if they are extended release or a slow release, then they're going to have to do liquid. Otherwise, I can't take them. I won't be able to
Well, the
take them.
cholesterol medicine you can crush for sure.
Exactly. If those don't work, then some crush will.
Wow, Julie, thanks for coming on. This has been eye opening even for me. I've not heard of this happening. And I wonder how often it happens.
I do too, and I'd like to find out. I don't know where to look to find out for other people that have this going on too, but I would love to find out how common this is. I'll have to.
Wow.
My GI doctor can tell me, or the hospital can tell me how common is what I'm going through. I
Right.
would think there's enough people out there with GERD that it's probably more common than I
Yeah,
think.
I bet.
Yeah, I just never thought I'd be one of them.
Okay, Julie, thank you for coming on. And I really would like to schedule another interview with you after you get going on your tube feeding because that's another thing that I think people need to realize can happen to you for many different reasons and how it
Yeah, and
changes your life. In your case, I think it's going to make it better.
yeah, I'm looking forward to it. I want my energy back. I want to be able to exercise. I'd like to be able to control the diabetes, so I'm not.
Right.
I want to get back to normal.
Right. Okay. Thank you for coming on.
Thank you.
I appreciate it. All right. Have a great
You
day.
too. Thank you so much.
All right. Bye,
Bye
Julie.
bye.
So, thank you everybody for watching and listening to Julie's story. Always remember if one doctor doesn't fix your problem, always get a second opinion. And I guess the biggest takeaway from this interview is something as simple as GERD can become life changing if it's not treated properly. So, thank you for watching. If you want to become happier and healthier, please check out the links down in the description section of this video. Visit our website at www.sunshinentc.com. I'm Pharmacist Michael. Be happy and be healthy.